My name is Kim Hines, and I'll be moderating the Access Health Connecticut Data webinar. Welcome, and thank you so much for joining us. Just a couple housekeeping things. You will be automatically muted once you log on so that our presenter can continue without interruption. We will take questions at the end, but anytime you have a question, you can type it into the chat box. And when it's time for questions, I will read that question to our presenter. If you find your audio component is experiencing difficulties, you may switch over to the dial-in and it will give you a telephone number. So we are off. I'd like to introduce Robert Blundo, the Director of Technical Operations and Analytics for Access Health Connecticut. Take it away, Rob.
Thank you, Kim. All right, great. So I'd like to thank everyone for joining today. I know everyone's got busy schedules, so it really means a lot to see such good turnout for an hour of reviewing what Access Health does from a data and analytics perspective. So I do appreciate the group of individuals who've joined us. I think we've got a good mix of individuals who've joined the call today. I think it's a mix of assisters, brokers, and community partners. So we're excited to kind of get forward with this presentation. So prior to this presentation, we got a few requests, and we thought it would be helpful to share a few things based on those requests. Those requests included a desire to understand how Access Health uses this data and analytics to serve its customers, how to request to essentially get a view of who the typical QHP customer is who's getting coverage through the exchange, a desire to get insight into the customer purchasing life cycle for insurance products during and outside of open enrollment. And then lastly, some of the trends that we see emerging both post-enrollment and during open enrollment that we've observed over the last year. So with that said, we're planning on doing a few things for this presentation. The first is to share some of the analytic capabilities that have been developed by Access Health over the past year, provide a high-level overview of the typical Access Health customer who purchases through the exchange, and then lastly, again, review those emerging trends that we've been seeing over the last year. The content that you'll be reviewing will be made available after this presentation. In addition, some of the content may look familiar. The content that we're showing today is content that we typically present at our board of director meetings. So what we'll be doing is essentially reviewing almost a full year worth of analytics from the board of directors perspective. So you'll see the end of open enrollment, a dive into some of the demographics and the customer product preferences. And then lastly, we'll round it out with some of the trends that we see emerging through the special enrollment period, leading up into our next open enrollment 4 period. So we're excited. Go to the next slide. So prior to jumping in, I just wanted to pause and provide some brief background on Access Health Connecticut and our analytic developments and a review of, at a high level, of what has happened over the last 3 years in our organization. We go to the next slide, please. So this slide shows essentially a 3-year overview of some of the progress that's been made since we've opened our doors on October 1st of 2013. You know, obviously, most folks know that we're a fairly new organization. We were created by the ACA. We opened our doors on October 1st for our first open enrollment period, which was a 5-month period, the longest open enrollment period that we've ever had. During that time, it was quite busy around here. It was the first year jitters of rolling out a new system, along with a learning process for a variety of new employees and new processes. As folks may have heard, you know, we were one of the better performing exchanges across the country, as some of them didn't fare so well. But all in all, at the end of that first year of open enrollment, you know, it was a fairly good event for us. We had exceeded enrollment expectations. Again, we were one of those top performers. And really what we found was at the end of that first open enrollment period, we had about 78,700 enrollees who had joined through a QHP program. And we also had processed applications for over 129,000 Medicaid applicants. Additionally, from that first year, we saw percent of the population, or 78%, was qualifying for a financial assistance, either an advanced premium tax credit or an advanced premium tax credit plus a CSR. In that first year, we found that about 31% of our population was under the age of 35. Anthem was the prevailing carrier. And in addition to that, we had processed 140,000 applications, or 140,500 in that 5-month period, so quite a bit of activity. We were averaging about 3 calls per completed application, and we had a web volume of 863,000 unique visitors. So it was a very busy time during that 5-month period. In addition to that, we had a very new system, and we didn't have an advanced analytic or reporting system to really leverage during that time. So over the last 3 years, we've made quite a bit of progress. We've implemented new reporting systems internally. We've started focusing on analytics on our customers, and you'll start to see that materialize in Open Enrollment 2 and 3. And in addition to that, in some of the statistics and the reports that we'll be showing in the future slides. So as we look at Open Enrollment 2, just a couple of changes. So Open Enrollment 2 was a little bit different than year 1. We started seeing an auto renewal process that was implemented for our QHP population. So you'll notice that about 67% of our population had qualified for auto renewals. What we mean by that is these individuals, assuming that they select the proper categories, which is the ability to look back at tax returns and the acceptance of an auto renewal preference, that customers will be automatically renewed into their plan, assuming there is an equivalent plan in the next year. We find that customers do like that because of the ease. However, there are customers that still certainly like to come back into our system and shop. But from a customer service perspective, it certainly brings down the number of interactions we have each open enrollment period. In addition to that, the increase in the penalty from year 1 to year 2 from 1% to 2% was a driver in enrollment and customers being driven to our site. In addition to that, it was the second year of the ACA being implemented, so there was certainly more education from the consumer's perspective about the value in getting coverage, as well as some of the penalties involved. So what we saw at the end of Open Enrollment 2 was really a net increase of 30,000 enrollees. So we went from 78,000 to 110,000. And from there, we headed into Open Enrollment 3 into that next year. So again, just an overview of kind of where we've gone for the last 3 years. In year 3, we saw the increase in the penalty go from 2% to 2.5%. So again, a little bit of a driver to help incentivize folks to go ahead and get coverage. We saw completion of transition from Medicaid Magi into Magi. So what that means is we had the full Medicaid Magi population come through our system, and you can see that in the increase of 1,000 to 442 to 608,000 Medicaid determinations made by Open Enrollment 3. Additionally, we started seeing a stabilization of the customer base. We didn't see large increases like we did in year 1 and year 2. We started seeing it slow down a little bit with about 6,000 in terms of net increase. And we also saw a gradual increase in the younger customer base. So you can see that in the population under 35, you're seeing it trickle up a little bit by 1 percentage point each year. Some of the good news in this, we're starting to see efficiencies as well. So as we just compare these 3 open enrollments, we're starting to see the calls per completed application, are starting to trend downwards, and we hope to see that trend continue. Additionally, much less web volume, although the volume of application continues to stay high. So again, more customers, more throughput, but fewer interactions on the customer side, which we view as if you can make this process more efficient, you can make it easier, then it's a win-win for everyone. So lastly, just as before we start diving into some of the analytics, we have Open Enrollment 4 coming around the corner, which we are looking forward to. Open Enrollment 4, unfortunately, we started seeing some stabilization. Open Enrollment 4 is going to bring about some big changes. We have a reduction in carrier offerings from 4 carriers to 2 in this Open Enrollment 4 period. We have a reduction in the passive renewal rate, which is going to increase the number of interactions we have with customers. Right now, our projections are that about 56% of the population is going to be eligible for auto renewals. So as you can see, we were at 80% in Open Enrollment 3, and we're going down to 56%. So we expect that to lead into more calls, more customer interactions, more consumer decisions. But again, we're staffing up and we're using these findings to make sure that we're prepared. In addition to that, carrier broker commissions have been eliminated by the 2 remaining carriers on the exchange. So again, this is going to be something that's going to drive call volumes, going to drive customer inquiries to the exchange and to the assisters out in the community. And also we have a new call center which has been implemented, which has new technology, new process for training, which we're hoping it's going to deliver a better experience for our customers. We're starting to see that pay dividends right now in our third week of operating. The new technology certainly helps us look at our customers as one complete customer and close some of the process gaps that we've seen in the past. So we're gearing up. Open enrollment 4 is starting on November 1st, so we're eagerly rushing to get ready for that. So as we start to dive into the analytics, let's just start off on the next slide with one basic question, which is, who is the average QHP customer? So after 3 years of operating in Connecticut, really, what do we know about the customers we serve? So on this next slide, we'll see what the customers are selecting in terms of carriers. Right now, we know that Connecticut is currently the leading or the most popular carrier who's been selected. They captured about 53% of the enrollments out there. In addition, we're seeing a general upward trend in selections for Connecticut. Among other reasons, over the years, I think we've seen customers select Connecticut more often because their policies are traditionally a little bit cheaper than some of the competitors, at least over the last 2 years. But there could certainly be other drivers in that, as in addition to their provider networks and what's in their formulary. Secondly, Anthem accounts for 33% or a third of the customer carrier selections. So with that said, these are the 2 carriers that will be left in the coming open enrollment period. So we still have our 2 largest carriers, and we're expecting some customer migration for the folks who are in the Health AHCT and United Health population. Go to the next slide. Here you'll see the customer eligibility results for financial assistance. Again, these results are the results for the end of open enrollment, the last open enrollment. What you'll see is a little over half of the population qualifies for an advanced premium tax credit plus the cost sharing reduction, and about a quarter qualify for an advanced premium tax credit only. So about 20% of our population at the end of the open enrollment period was an unsubsidized group, meaning they don't get any sort of premium assistance. Traditionally, what we find after open enrollment is once folks begin to verify their information, such as income, we typically find that the population with no financial assistance starts to trickle up. And currently, we see the percentage of enrollees with no financial assistance hovering around 22 to 23% right now. So it certainly trickles up a little bit during the year as folks continue to perform verifications throughout the year. So the next slide shows the customer selections for metal tiers. So again, we'll see that 61% of the population is selecting a silver plan. The silver plans are the basis through which individuals can qualify for cost sharing reductions, as well as how APTCs are calculated. So it is expected that we see customers typically start to steer towards that silver selection. In addition to a very small portion of the population, in terms of the metal tiers and what they mean, we know that each metal tier is supposed to represent how much of an enrollee's cost is covered through that plan. So, for example, platinum plans are configured so that their actuarial value covers 90% of the total cost of essential health benefits. And then lastly, we see catastrophic plans, which account for about 1.7% of the population. Those plans are typically consumed by customers who are 30 years or younger. Their benefit and their design is a little bit less than less than the metal tiers above. So, we traditionally see a much lower percentage in that bucket. So on the next slide, we'll see essentially the metal tiers selections by the buckets through which individuals are determined eligible for financial assistance. The reason why we break this out is we found that our customers that are in the different buckets for financial assistance are quite different. A customer who falls into the advanced premium tax credit plus cost sharing reduction is typically lower on the FPL scale, as well as their cost sensitivity is much greater than those who don't have financial assistance. So the reason why we break this out is we do see differences between these different customer groups and how they appear in those buckets. So for example, you're seeing 81% fall into the 81% of individuals with an APTC plus CSR selecting a silver plan. That's by design. They need to select that silver plan to take advantage of their cost sharing reductions. We see 12% of those cost sharing reduction enrollees picking a bronze plan, which is actually a little bit troubling. Those customers are bypassing the benefits of their cost sharing reductions. And it's something that we've noticed over the last 2 open enrollments. This year, during Open Enrollment 4, we'll be sending out educational packets to these individuals and making sure that we can help educate them on the benefits that they're foregoing by not selecting a silver plan or higher. Additionally, we see the no financial assistance population, the folks who don't get that APTC, are typically skewed a little higher towards a bronze plan, so they're aiming for a lower premium per month. And obviously, they don't have the incentive to go with a silver plan like the other 2 categories in terms of a cost decision. So a quick recap of who is the average QHP customer. We're just going to review the high-level demographics of the population, and we're going to do it through the lens of the end of the open enrollment period 3. So this would put us roughly around March of 2016. So here's what we know. We know that our customers vary quite a bit by the eligibility of financial assistance. The other thing we know is that our customers vary quite a bit in terms of their tenure in the exchange. We have individuals who are existing customers who traditionally have much greater lengths of span of coverage. They're fairly solid in terms of purchasing their coverage and maintaining their coverage through the exchange. We have individuals, and sorry, let me take a step back. These individuals we dub the existing customers. So these are individuals who had coverage prior to the beginning of open enrollment. We then slice our customers a different way, and we look at them as repeat customers. So these would be individuals who had an account with Access Health prior to the open enrollment period. However, they did not have coverage prior to open enrollment. So this would be indicative of them being enrollees at some point between Medicaid or a QHP program, but not enrolled prior to 11/1 of 2015. And then lastly, we look at our customers as brand new customers. These are individuals who are brand new. They start a new account during the open enrollment period. So they're fresh faces. We've never seen them before. So a couple of quick findings on how these customers our total population looks and how they differ. So at a high level, we know the average household size for our customers is about 2.6. Average age is about 42.7 years old, and we know that the new customers that were coming into the exchange, at least during the last open enrollment period, were slightly younger. We know that the split for the female population is about 52%, so we're slightly higher in terms of females. The average FPL level for the folks who do report income, meaning you need to report income to be determined eligible for financial assistance, that threshold is the average is 215%. The average after APTC premium is $185 for the entire population. And then we have percent of Husky transfers. So what we do is we track our customers in terms of whether they are transferring over from a Medicaid coverage or Medicaid plan. And what we find is that, as you might expect, the repeat customers are much more likely to be prior Medicaid customers, partially by definition, but also we're starting to see an emerging trend, and we'll touch on this a little bit later in terms of individuals who are close to that 200% FPL level, and they come in and out of eligibility for APTC, CSR, and then Husky coverage. So we see that percentage much higher, and we'll dive into that a little bit more in some later slides. So the next slide, we'll see the geographic locations of our population. So this is just a QHP population. The preponderance of the population is located in the Fairfield County, with 4 of the top 10 cities falling in the Fairfield County. Additionally, as you can see from that heat map by zip code, you'll notice that there are a majority of our population really resides in urban areas or even the urban outskirts. So you'll see in the Hartford area quite a bit of enrollment in the Hartford area. Bristol is a large city in terms of enrollment. And then that Fairfield area, the pockets along with, if you were to overlay this with density of the population, again, you'll see it's somewhat correlated. Moving into the next slide, we look at the distribution of our QHP customer base by race, ethnicity, and language. So the information that's collected through the AHCT application for coverage, through that application process, we ask our applicants to provide this information. It's an optional question. It's not mandatory. And we find that about 33.5% of our applicants don't provide a response to this question. So what you're seeing here is the results for the applicants who do provide a response to that. Overall, we see the split of race and ethnicity for our customers follows roughly the split that we see through Connecticut, just based off of the 2014 census. It's off by a little bit. So the Hispanic population, Hispanic Latino population is off by about 2 percentage points. And then conversely, we see the African American and Black population in Connecticut is about 2 percentage points less. But overall, somewhat aligned in terms of the distribution across Connecticut. On the next slide, we see that breakout as well for the language preferences that are provided. Again, a majority of the population is, or 92 or 93% of the population is preferring on their application to be communicated to in English. However, we do see about 5.8% of the population is selecting Spanish. That selection of Spanish is slightly different than some of the internal surveys that we perform. We found through our member censuses each year that about 15% of the survey respondents are indicating that Spanish is their preferred language. So we do see a little bit of a discrepancy here. However, we continue to look at this as we do our annual member censuses. All right. So what trends have emerged during open enrollment period? Open enrollment is the 3-month period traditionally, at least for the last 2 years and for this next year. During that open enrollment period, we do see a lot of activity. We see QHP renewals, so we see folks coming in and they're repeat customers, so they have to do the renewal process. We also see an increase in Medicaid applications. When we opened our doors on 10/1, we had a large volume increase of applicants, and some of those folks qualified for a QHP, other folks qualified for Medicaid. And because we have a 12-year span for renewals in Medicaid as well, obviously that open enrollment period is traditionally a time when there is not only a lot of QHP renewals, but also Medicaid renewals. In addition, during that open enrollment period, we see an increase in advertising and marketing, which also drives individuals in through our website and makes it more likely for them to start an application and then seek assistance. Additionally, we see policy and plan changes. We see plan management changes, the offerings for plans that are out there, disruption in the market, let's say through carriers. So again, all of that drives activity into our doors during the open enrollment period. In addition to that, we see pent-up demand from enrollment for folks who do not have a qualifying event during the year and they cannot qualify through a special enrollment period. They traditionally wait for the open enrollment period and then come in and start to apply and try to gain coverage into a QHP program at that point as well. So the open enrollment periods are traditionally a very busy time for not only Access Health, but obviously all the folks on the phone here, brokers, assisters, et cetera. So from an enrollee perspective, there's a lot of actions that are occurring. They're updating the information on their application. They're making a decision on whether they'd like to renew or not renew. They're shopping for an existing policy or a new policy, depending on what their experience was over the past year. And then they're choosing, hopefully, the best coverage for themselves and their family. So what we wanted to do with these slides is really show some of the analytics that we produce during the open enrollment period and how we break out and segment the enrollee base to get a better understanding of who they are so that we can serve them better in future years. So in the current slide, what you'll see is a breakout of the customer status during the open enrollment. Again, you'll see that 21% of our population is essentially brand new customers each open enrollment period, or at least the last open enrollment period, but it's a trend that's emerging. We see about 15% of the enrollment are repeat customers. So these are, again, those are folks that had an account but weren't enrolled prior to open enrollment. Again, a large portion of those may be Medicaid transitions, but they also may be individuals who lost QHP coverage or Medicaid coverage a long time ago, and they're just coming back into the system and re-enrolling. The next slide shows some differences in our customers between those different categories. So again, similar to what we had reviewed before, the repeat customers are more likely to fall into that higher subsidy category of APTC plus CSR. And subsequently, our brand new customers also traditionally look a little bit more like our existing customers. You know, there's not as much difference. However, we do see a little bit of an increase in terms of the no financial assistance category. Overall, we see, again, roughly 75% of the population getting a subsidy and about 21 or 22% being non-subsidized. at least during this last open enrollment period. As we continue. So this next slide shows us some of the shopping habits of our customers during the last open enrollment period. What you'll see here is essentially of the 79,000 customers who were repeat customers or existing customers, 17% had selected a different plan in 2016. Now that may mean they selected a different plan outside of their metal tier, or they may have selected a different plan within their metal tier, but it's indicative of them essentially shopping. What this doesn't capture is folks who shopped but didn't select a new plan. Additionally, we see that nearly 20% of the enrollees were eligible for APTC-only plans, and they selected a different plan in 2016. So on the next slide, we'll see a little bit more on that. So what we see here is essentially the breakout, again, by those financial assistance categories, because we do know that these customers are different in terms of their shopping habits and their preferences. What we're seeing is nearly 24% of the shoppers selected a lower metal tier. About 12% had selected a higher metal tier, meaning they were seeking richer benefits. And 62% of those folks who had shopped around and selected different plans selected an equivalent metal tier. So essentially, they were picking something that was very similar in terms of benefits, but they were selecting a different plan. And what we found from this, we don't have this slide showing, but what we did find from that is that the individuals who were shopping, as you might expect, often, or a majority of them, while shopping, had a lower premium increase than those who did not shop. So again, it's an indicator that folks who are coming in and shopping are often doing so because they're being cost conscious. What we see in this next slide is a breakout of the average premiums by FPL percents. What we see here is essentially in the average APTC for the entire population ranges from $26 to about $386, depending on the FPL category. And this is always the after APTC premium. So similar to the open enrollment period, what trends are we seeing emerge during the special enrollment period? So special enrollment is traditionally a 9-month period where we see a few events occurring. First is that downward pressure from the end of the open enrollment period, in which customers need to make their first premium payments and subsequent premium payments. And also they have 90 days to complete the verifications that traditionally they're enrolling during the open enrollment period. So we've got some downward pressure on enrollment from that perspective. Additionally, we see downward pressure because obviously folks who are coming in during special enrollment need to have a qualifying event. So it's a less easy task to essentially get coverage during that period. In addition to those two factors, we traditionally see that the results of our net enrollment steadily decreases over the course of the special enrollment period. So in some of these slides, you'll start seeing a natural churn is observed. From an enrollee perspective, for existing enrollees during special enrollment, there's really two things that are driving their enrollment. The first is the need to continue making their premium payments. The second is to close out any open verifications that they have. And then from a new enrollment perspective, new enrollees coming into our doors through special enrollment need to have a qualifying event, and then they essentially have the same requirements that a open enrollment enrollee would have, which is performing the verifications and the premium payment requirements that they have during the enrollment period. So on slide 22, we see the enrollee churn that's observed, and for this slide, it's, excuse me one second. Can you go back up one slide? I think we've just gone off there. There we go. So on this slide, we see the enrollee churn that was observed 3 months following the last open enrollment period. So this is the time in which there is the most activity because of that 90-day period in which folks have to perform their verifications and make premium payments, et cetera. So with that said, what we want to do is we want to capture some of the churn that occurs not only from terminations and cancellations that occur after open enrollment, but also the additions that occur during special enrollment. So you'll start to see some trends emerge here. The first is that 18.8 thousand terminations or cancellations occurred since the end of the 2016 open enrollment period. So that was roughly 3 months after the open enrollment period. What you'll see here is that it steadily declined from February to March, and what we saw at least at this point in time, is that it essentially hit its peak in April, and then at that point it steadied out, and we saw the rate of terminations and cancellations hit a steady state, so to speak. In terms of special enrollments, we found 7.9 thousand new enrollments since the end of the 2016 open enrollment period. And you'll see that there's about 3,000 new enrollments per month, which is essentially the natural rate that we saw emerge post-open enrollment. So we continue to see that, and it's just a natural churn rate that we're starting to see emerge in the exchange during SEP periods. So some of you may be asking yourself the question, which is, for the folks who did disenroll, what were the reasons that they were disenrolling? So we know that of the 18,000 after that open enrollment period that disenrolled, nearly 75% of them had disenrolled and for reasons related to non-payments. So what you're seeing here is essentially a hierarchical breakout of the terminations. So it's a little bit less in terms of the total folks who had been identified for non-payment. 12.4% were determined eligible and they had transitioned into a Husky program, and about 9.8% requested a cancellation, which is really an indication that the individual is canceling their coverage voluntarily. That is a pretty hard metric to measure, and the reason why is we know that some of our customers essentially cancel by simply not paying. They know that if they don't pay their bill, that their coverage will be canceled, and it's maybe easier than calling the carrier or calling Access Health to put that request in. So, when we look at these results, we just have to caveat them a bit and understand how they're generated and some of the customer actions that result in them being generated. On the next slide, we see of the population who did disenroll within that 3-month period after open enrollment, what their tenure was. And really what we see here is essentially the clustering of tenure. So again, as I mentioned earlier, the large portion of the activity, or a little over a third of the population, traditionally falls out within the first 90 days, and that's really the most rigorous time span for them in terms of being able to complete verifications, etc. We also saw about a third of the population who had greater than 271 days, and this was really measured as of June of the prior year. So it's not their entire tenure. We just have to draw a line in the sand. But really what we're seeing is really a split. It's a portion of the population is customers who are falling out related to open enrollment requirements. And the other is a natural fallout rate that we just see in our population as folks get jobs, or they decide they don't want coverage, or they find coverage through alternate means. They're just naturally falling out, and then there's a natural uptick through the special enrollment period, which starts to level that net enrollment out as well. So, good segue into the next slide. What you'll see in the next slide is the special enrollment reasons for the folks who have come into the exchange. So what we did was really focused in on that first 3 months of folks who had come onto the exchange. What you'll see here is that 82% of the special enrollment were individuals who were testing to a loss of coverage or loss of MEC either in the days. And then additionally, it was followed up by about 7.7% of the population essentially coming in and getting coverage because they lost or gained a BTC or CSR eligibility. And then you'll see the rest of them break out. So I mean, you can start getting an idea of really the predominant reasons that folks are coming in through the special enrollment period. As a side note, Access Health is beginning to roll out a special enrollment process, much like the federal government has, in which there is going to be additional verifications related to the attestations to qualifying events. So we do think that these numbers, at least the volume of special enrollments, may decrease slightly in the next month as that process starts to follow a verification process that's very similar to the initial enrollment process during open enrollment, and as well as new enrollments. And then another breakout of the special enrollment. So who are the special enrollment customers? 42% of the population who come into our doors through special enrollment are essentially brand new customers. 37% are customers who have transitioned from a Husky application. And then again, 12% have failed to enroll by open enrollment. So essentially they disenrolled since open enrollment and they came back into the mix during the special enrollment period. So kind of interesting results. Again, we start to see a little more evidence of some of the transitions that are observed through the Medicaid program and the QHB program, as customers or enrollees start to transition between one program and the next based on their income and what they qualify in terms of what financial assistance and what programs they qualify when they come through our system. And then again, we have one more update here. So this again is another snapshot of the population. This was taken in May of 2016. And again, it starts to count the population that has essentially churned through our system. So what you'll see here is we've had about 92,000 customers that were customers since the open enrollment period. And of those customers, we know that about 6.59% of them, or 6.6% of them, were customers who had Medicaid coverage in the prior year. Conversely, when you look at the population who is the special enrollment population, we had about 11,200 in the month of May. And we see a much larger proportion that were Medicaid transitions. About 35% of them were transitioning from a Medicaid program. So again, a little more insight into some of the natural churn rate that we have in our population. And then again, for those populations who churn, where are they coming from and what are the reasons? All right, so at this point, I'm going to pause and kick it back over to Kim.
Thank you so much, Rob. There was a ton of information there, and again, we will have the slides available to you afterwards. And I just wanted to talk a little bit about reaching those individuals who do not yet have coverage. We're paring down that number, but there's still a lot of people out there that need to enroll, and we're hoping that all of our community partners can help us out with that. And I just wanted to talk a little bit about ways that you can partner with us and help people access that health care. So very importantly, we have our wonderful community partner website, which is at learn.accesshealthct.com/community. And there you can find news, you can find the webinars that we have put on, and you can sign up for getting us to come and speak at your event and all sorts of things. You can also download materials. As well, you can sign up for our email list for our newsletter, which is really wonderful. And best of all, we are having our first annual community conference on Thursday, October 13th at the Radisson Hotel in Cromwell. It's going to be free, and it's going to have really some amazing speakers. So we're really excited about that and hope that you can RSVP and send folks from your organization. We have a number of materials that can be downloaded directly from the web, or I can get those to you. Currently on the web right now, we have English and Spanish of the topics, when can I enroll, immigration status and getting healthcare coverage, getting help paying for healthcare coverage, what happens after you enroll, and the tax penalty, which is going to be steep this year. In just a week or so, we will have even more updated materials for you. Another way you can partner with us is to invite us to your events. We'd love to table at events and give people information about how to access health care. And we can do that two ways. You can fill out the form on our community partner website, or you can email outreach@accesshealthct.com. and we will get back to you about your event as soon as we can. So if you're not already a partner, please consider becoming one. A couple of ways to go, 327-5517 and leave a message. Again, you can email outreach@accesshealthct.com. You can visit the website, learn.accesshealthct.com/community. And finally, I urge you to follow us on social media @AccessHealthCT. So we're going to go back to Rob. If anyone has any questions, I see our first question has already come up. How does Access Health Connecticut use analytics and data to help your customers?
I appreciate that. Thank you. That's actually a very good question. So there's a few ways that we're currently using analytics and the data that you're seeing here to help our customers. And it really covers a few different areas. The first is from a community perspective. I know many of the folks on the phone may have remembered us during year one, and the information we shared with the community was fairly sparse. We're working our hardest right now to make sure that that we can share as much information as possible and really empower the community to understand the kind of environment that we're working in, and also help them out to do their jobs more efficiently. So really, I think the first one is we're sharing more information with the community that we have in prior years, and we're looking forward to share more as we continue to kind of build up our capabilities internally. The second one is outreach. So you'll hear me oftentimes call our enrollees customers, and the reason why is we're really focused on customer analytics. And what we're doing with customer analytics is really fairly basic. However, for an organization that is turning 3 years old in October, it's things that I think are really huge value added. In year one, we didn't have the luxury of knowing who our customer was. We didn't have the luxury of knowing what our customer was exactly going to look like and where they would be located. And we have that now. So we're able to create custom, customer-specific educational material, outreach, and marketing, where it's really more efficient. We get a bigger bang for our buck. In addition, the customers aren't receiving as much information that is generic. Now, oftentimes, they're receiving notices that are very specific to the situation. We mentioned an example of that a little bit earlier, which was the ability to send out educational material to the folks who are eligible for a CSR but are not selecting that silver plan. That's the type of capabilities we're building up internally here, and we're hoping to continue to build that. Right now, we're really doing things in a retrospective manner, but as we continue to mature as an organization, we're going to start looking forward prospectively so that we can help our customers out more effectively. The third item that we really use this to help our customers with is from an operations perspective. We've got a lot of vendors that we work with. We've got a lot of touch points that we have with our customers, from the call center to our own customer internal Tier 3 center to the broker community, et cetera. And being able to use the data to understand what's happening in those environments, how do we make them more efficient, where are there bottlenecks in the process, is a huge value added, and the customers may not necessarily see that on the outside. However, as our processes continue to improve, they are a benefactor of that. So we're really using the analytics internally here to make sure that we're working smarter, we're working more efficiently, and that the process improvements that we're putting into place are data-driven and not driven off of anecdotes. So it's some exciting things that we're doing here. I'm really happy to be part of it.
That's great. Another question came in. How do you think enrollees can use this information? Sure.
So enrollees looking at these reports, I think some of them may find them interesting, but it may not necessarily help them from an enrollment perspective. And it's not really intended to help someone enroll. However, in terms of what we have available to our customers, we do have some tools on our website that I think are valuable. The first is we have a consumer is a tool which uses New England medical experience and our plan designs and our plans that are offered on the exchange to help customers enter in their risk profile. And what I mean by that is the conditions and their expected costs for the future years for them and their family. And what it does is it pairs it up with the plan offerings that we have on the exchange to give them an idea of what they could expect in coming years for a out-of-pocket cost and their premium costs. So our hope there is to use tools like this to help our customers predict not only the benefit of having coverage, but also the financial impact of, well, number one, the financial savings of having it, the financial security they gain from it, but also some of the out-of-pocket costs that they might expect in having health coverage. There's a lot of folks out there that kind of understand what the impact is and some of the downsides, so to speak, of out-of-pocket costs. But there's a lot of folks who are getting coverage for the first time, and some of this may be new for them. So having tools like that is extremely important. So these reports may not necessarily be digestible for a consumer, but some of the tools we're putting on our website are. So we're looking forward to continue to develop that tool and hopefully make some improvements to it. And in addition to that, the application process, I think it's important that customers remember to continue to update their information on their application to make sure that the eligibility that they have is the latest and greatest based on their current information.
Okay. So before we ask any more questions, I just wanted to mention that we really value your feedback after these webinars. We use how we do the webinars, what topics we do. So on the chat box, there's going to be a link to a very brief survey, and we ask that you go there and complete it. It would really help us out. Let's see. Oh, one more question came in. When does Access Health CT release information like the slides we just reviewed?
That's a great question. The slides that you reviewed here for this presentation were essentially taken from Board of Director updates. Every month we have a Board of Director meeting, and traditionally I think the trend has been every other Board of Director meetings will typically go out there and share some of the analytics that we're finding throughout the year. So you can find all of these on the AHCT.ct.gov site, which is where all of the Board of Director meetings are maintained, and there's much more content than what we just reviewed today. Additionally, every time a Board of Director meeting or an advisory committee has had, those slides are again posted up there. So traditionally that's the best avenue if you'd like to keep a finger on the pulse, so to speak, on what reports and information are being shared with the community and through Access Health.
So are there, just as this is going to be the last call for any further questions, and if there are none, I just want to thank everyone so much for taking time out of your day to join us. I am going to leave the webinar up for just another minute or two, so you can click on the SurveyMonkey link and just let us know how you felt about this webinar. Thanks again.